This season, we witnessed Gretchen go to the fertility doctor to weigh her options for motherhood. Here's Slade making a doctor's visit of his own to check on the status of his manhood.
Hi.
Hello.
How are you?
Hi, doctor. How are you?
Good. I'm Dr. Aaron Spitz.
Nice to meet you, Slade. This is
Hi,
Gretchen.
Slade.
Hi,
Gretchen. How you
Gretchen.
doing?
Very nice to meet you.
Welcome. So I understand that you're here to find out about reversing your vasectomy. Is that correct?
That is correct.
Okay. Well, let me have you sit over here, if you don't mind. Gretchen, if I could actually just step outside the door for just a minute or two.
Yeah.
And I'll examine you, Slade.
I'm hoping that the doctor's going to be able to repair his snipperdoodle because I actually really like the concept of having the baby naturally. You know, science and petri dishes and sperm and egg and all the stuff that goes into that, it's like, doesn't make it very romantic anymore.
How'd it go, kid?
He has very lovely hands.
With the vasectomy reversal, I want you to refrain from exercise and sex for 4 weeks. I said to not exercise for 4 weeks, yeah.
Which means you better dress in very baggy clothing and not be sexy at all.
Seriously, like, he just looks at me and he's like ready to have sex. It's like crazy.
Should I leave the room here?
I literally could be wearing a paper bag and he's like, you're hot, babe. I'm like, oh my gosh.
I might have my wife wear a paper bag. We'll see how that works.
Yeah, see how that works.
Decided that the in vitro was a much more quicker way to make things happen for us. So tomorrow morning, it's my egg retrieval surgery. Slade gets his testy surgery the same day.
We're going to be doing a sperm extraction directly from the testicle. There'll be typically thousands of sperm within that small tissue. Now I'm going to pass this off to the embryologist. And now Gretchen's up next.
I'm excited, let's make a baby.
I really appreciate this segment because I think more than any segment we've ever done on IVF, your story has brought it to life. Allowing us to follow you through that process, you realize what not only an emotional toll is it, physical toll. You know, you have the eggs, you have the sperm, and you know, just watching the procedure to retrieve the sperm, you and I looked at each other, and I was like, that wasn't even my testicle, and it was tough to watch.
Dr. Spitz has very gentle hands.
I was getting emotional at that segment.
But everything did look good on.
Well, yeah, no. Slade has what I would call the real cojones of Orange County. He had an excellent sperm.
After we were on the show, Gretchen ended up being allergic to the progesterone shots. And so the whole IVF process was quite challenging.
Vasectomy reversal is a good option for Slade and Gretchen at this point because it's a reasonable alternative to in vitro fertility. So we're going to make an incision in the scrotum, one on each side, come down onto where the vasectomy scar is, cut out that vasectomy scar, and then reconnect the ends back together. I'm going to cut the vas deferens just below the scar. So there's going to be fluid in here, and we're going to see if there's sperm parts that's in the fluid getting all the way up to this scar. Okay, great. Yeah, he's got sperm present here. So we're good to do a connection here. There is no other blockage that I have to worry about. Here's a regular suture that is used for a lot of steps of most surgeries. This is a microsuture. The caliber of that stitch is much thinner than a human hair. I'm going to sew these two passages together. The passageway is in white, contrasted with the blue. So this magnifying microscope will magnify things up to 20 times. Coming together very cleanly. This is very good news. It makes his operation more likely to be successful.
Please welcome Gretchen, Slade, and urologist Dr. Aaron Spitz to the show. And Slade, first things first, how are you feeling?
I will tell you that the people I told I was going to go through this thought I was a little nuts. But Doctor has fantastic hands. So I'm feeling pretty good, actually.
I told Slade that he could not have sex for 4 weeks. But I didn't give Gretchen any prohibitions. But no, so yeah, no sex, no exercise for 4 weeks, and Slade did tell me he was really going to miss the exercise.
As we all do. By the way, for those of you that don't know, and I mean this, Dr. Spitz is a comedian in his spare time. Yes. Legitimately. Understand, Joseph is actually getting what Dr. Spitz calls the Cadillac of vasectomies.
Yeah.
In fact, it is a non-invasive technique, is it not, Dr. Spitz?
Well, it's minimally invasive. I do have to get to the vas deferens, but it's the least invasive way we can do it. We're able to give him some numbing medicine without a needle, and we're able to access the vas deferens without a scalpel. So it's the no needle, no scalpel vasectomy. I like to call it the no problem vasectomy.
Are we ready?
One small snip for Joseph, one giant snip for television.
Obviously, in the right hands, this can be a very effective procedure with minimal complications.
Yes, indeed. The complication rate is minimal. It's about 1 or 2%.
And Dr. Spitz, how quickly can he go back to having sex with his wife? Of course, he's wondering.
He can get back to sexual relations in a week. But
You got a week off, girl. You got a week. Joseph is smiling.
Don't laugh, Joseph.
Only Joseph has to wait a week.
So, Rosalie, for the record, Dr. Spitz is a true part-time comedian. And I'm not kidding. He's legitimately a part-time comedian. This just in, scientists have created robotic sperm.
Oh, thank goodness.
Well, you know, it's not exactly robo-sperm. What it is for a special circumstance in which the sperm can't move on their own, this is a little nano corkscrew device that actually wraps around the tail of the sperm, picks it up and carries it over to the egg where it attaches and then slips off. So it effectively picks up the sperm and drops it off. It's like a Uber for sperm.
I mean, one less thing for men to do.
Well, there's something that every man should eat after dinner to get a boost in the bedroom, and that's berries. It turns out that berries are full of flavonoids and other great chemicals that help prevent erectile dysfunction or improve erections. And berries are not unique. Keep talking.
Do you want some, Dr. Spitz?
Yeah, I'll take the little blue.
You want the blue ones?
All of these great ingredients in fruits and vegetables, and particularly berries, which are really concentrated, they help promote the health of your blood vessels, of your heart. And, you know, in urology, we always talk about that the importance of the heart is that it pumps blood to the penis.
That's what we say in gynecology about the uterus.
See? But the thing is, if your penis isn't getting the blood pumped to it adequately, you won't get an adequate erection, and that could be an early sign of heart disease.
Yep.
Yes.
And so, if you want to lower your risk of heart disease, improve your performance in the bedroom, I think he's had enough.
That was a fastball, Dr. Spitz.
Yeah!
You guys are going to be all right here.
Now, we constantly try to get people to eat healthy.
Yeah.
Men, this is a damn good reason to eat healthy.
Yeah.
Is it not?
I mean, if you
women too, right?
Women, it's a really good reason to eat healthy.
Yeah, and you know, you hear all the time, eat your vegetables, but it's really true. I mean, science keeps showing us the health benefits of fresh fruits, fresh vegetables. So, you know, if you want to be making bacon, don't be eating bacon. Eat this stuff right here.
So, is there a time, like, is this something really we should be teaching young men? Look, start eating berries.
Yeah, this
early
is
on.
something. Yeah. You know, you got to balance that with sex ed. You know, just say no, but eat some berries in case you say yeah. No, but you know, the little blue berry is not going to work like little blue pill. You can't just, you know, eat a bunch of blueberries and an hour later, you know, expect to find your thrills on Blueberry Hill.
This isn't going to give you a 4-hour erection.
Right, exactly. Well, you know, maybe the packaging for the blueberries is going to change now.
Right.
So
I know where we're starting off.
we like props. So, Drew, there's your prop.
Yes.
Oh, no.
Trade it.
Okay.
Thank you.
I'm comfortable with my banana.
This is reality.
This is when I was born.
So why the obsession with size? Why is there, I mean, there is such an obsession, but you actually have an answer.
I do, and there has been one heck of a study worldwide. And the average size of a male penis worldwide is 5.6.
Yes! Doesn't it feel? Congratulations! You must be above average.
I mean, the new social media age has brought on a lot of new phone apps. Well, our producers actually found 2 apps that can actually test your private part size. One, what you do is you take personal stats like height, your shoe size, you input them into the phone.
Your hands, big hands.
Like, I don't know, it literally says porn star up there. I don't know what that really means, but you input them, then you shake the phone, and then I guess what the average size for your stats comes out.
See,
now,
this is perfect for dating. You know, ladies, you're going on a date, you meet a guy, you're kind of wondering, is this a waste of my time, or how is this going to go?
I just have a technical question. If you shake the phone more, does the prediction get bigger?
well, Carly in Gainesville, Florida writes to us, Dear doctors, I'm in my early 30s and after 2 kids, I have a little urinary problem that my husband calls pee dribble. What causes that? And more important, what fixes it?
Fantastic. Here's a model of the bladder. This is the bladder full, and I'm going to take this clamp off.
And it's pink. We know it's a woman's bladder.
That's right. So if a woman's control muscles are a little bit weak and she coughs or strains, there's a little bit of a dribble. But if a woman's muscle is spastic and she can't really control it, it'll just empty out on its own, squeezing and make a mess.
And you can't control it.
So, and there are treatments for this. In the case of the dribbling because of the weak muscles, you can strengthen those muscles with minimally invasive surgeries. And in the case of the spastic bladder that wants to squeeze by itself, you can take medications so that the bladder isn't so spastic and doesn't involuntarily contract, sort of like this is your bladder on drugs. Any questions?
Jake, 15, and she wants to know, my boyfriend constantly has a problem keeping his pee in the toilet, and why can't he stop spraying all over the bathroom floor?
We have a potentially great demo of this. What do you think?
Yes, let's demonstrate.
It just so happens that we have a toilet.
All right.
All right.
Now, this looks vaguely familiar. I have 3 boys at home, so our bathroom is kind of like a water park. All right, so this is my bladder. And, okay, so I'm the boyfriend, and kind of stumble into the room. I probably don't even bother to turn the lights on. I definitely don't lift up the seat. If I was a nice boyfriend, I would turn the lights on. I'd raise up the seat and position everything properly and have a nice talk. However, if I had a urethral stricture or the opening was a little narrow or my prostate was swollen, a prostatitis, inflammation, then this passageway would get narrowed down. And then when I went to go, it would spray. All over. Oh, my God.
This is a little bit embarrassing.
It's more embarrassing for me than you.
Well, yeah, so we've been together and everything, but he's always having a problem urinating after sex.
Let me show you how this works. When you ejaculate, the semen is deposited in the base of the urethra, and the bladder neck has to squeeze shut so it doesn't go backwards into the bladder, and then muscles at the base of the urethra pump it out the penis. So when that bladder squeezes shut and you try to pee, it kind of gets hesitant, doesn't really want to open up yet. It's not ready because it's been squeezing shut real tight. So you got to give it a little time. It's sort of God's way of telling you to cuddle.
Okay.
Yeah.
Hello, doctors. This is my wife, Paula. My name's Michael. I'm 50 years old from Bandera, Texas. My wife and I think we've injured my penis.
Yep, I used to stand straight, but now it leans to the left, as if someone has bent it at an angle.
How could this have happened? Could you
Please
help
help us, doctors.
What's your most embarrassing sex question? Well, that one sounded serious enough that we called in a specialist. Please welcome board-certified urologist Dr. Aaron Spitz. And also join us are Mike and Paula, who you just saw on the tape. And thank you both for coming, but also thanks for asking the question, because this is something that's really important for us to talk about. And the first thing I'm going to ask you, Mike, is do you have discomfort during sex?
None whatsoever.
None?
No.
Well, you know, I'm glad that we're talking about this, and you did examine Mike before the show.
Yes, I had the opportunity to examine Michael before the show. And the good news is, although it's not broken, although leaning to the left in a red state like Texas can be a problem. So I'll do my best to help you.